So the first thing is that, as we said on the weekend, Australia is one of the best prepared countries in the world. We have always assumed, and Paul has said on many occasions, as has Brendan Murphy, that there will continue to be variations and variants. And that is exactly what we're seeing, but it's also exactly what we have prepared for as a nation. In particular, we are one of the most highly vaccinated societies in the world at now 92.3%, 86.8% second doses. Children, 12 to 15, and now at over three quarters at 75.7%. And for our 60 plus, so everybody 60 and over, the country is now at an extraordinary 98.9%. So our 70 plus, we're already at 99%, but now everybody 60 plus is at that level. We are one of the most recently and freshly vaccinated societies in the world, and we, after Israel, are one of the earliest nations in the world to have commenced a whole-of-country booster program with over 415,000 boosters already delivered in Australia. In relation to the variant, I'll discuss the actions, and Professor Kelly will take you through the latest information. The actions taken, as we know, already we've stopped the flights from 9 countries in Southern Africa. We have temporarily banned non-citizens who have been in those 9 countries from entering Australia. We've required Australians who have been in those 9 countries to have 14 days quarantine. We've applied those rules to those coming under bubble arrangements, travel bubbles, and we've also required returned Australians who have been in Australia prior to the commencement of these rules to undertake quarantine from 14 days after for as long as 14 days after their departure from Southern African area. And we've worked with the states and territories who have put in place public health orders to cover all arrivals with home isolation for a 72-hour period if they're coming into Australia. There are additional actions which the Australian government is now taking. Firstly, the Prime Minister is convening the National Security Committee today to review the evidence and to review the range of actions in relation to the Omicron variant. We will not hesitate to take additional steps if the medical evidence is that more are required. We convened our first meeting on this on Friday, and on Saturday we took the steps to cease those flights and to close those borders. The Prime Minister is, secondly, convening a meeting of the National Cabinet within the next 48 hours to work on ensuring that there's common understanding, common information and common actions amongst all of the jurisdictions. And I want to thank the states and territories for their cooperation. Over the weekend, we worked at the level of the Prime Minister, the Health Minister, the Secretary of Health and the Chief Medical Officer to be in touch and provide information to all of our colleagues. Then I have, as a third item, asked ATAGI to review the booster timeframes in light of international evidence more generally with regards to immunity, and also in light of the Omicron variant. And we will, as ever, allow them to act independently and continue to follow their advice. But we're prepared with supplies. We are already one of the earliest nations in the world after Israel to have a whole-of-nation booster program. If they recommend changes, we will follow those changes. Then fourthly, I've also reaffirmed exactly what was in place. I've spoken with the CEOs of Pfizer and Moderna Australia over the course of the last 24 hours, confirmed that as our contracts had already prepared for variants, that if there were a requirement for a change, that they are ready and we are ready. And both have said, yes, that's exactly as the contract set out. But, and Professor Kelly will go to this, the early advice is that there are no signs at this stage that there is any breach to the integrity of the vaccine program, but we will follow the medical advice and the scientific evidence on that. The last thing that I want to say is that to give people confidence, we're in a vastly different position from where we were on the 1st of February 2020. We are one of the most highly vaccinated, one of the most recently vaccinated, and one of the first to commence a whole-of-nation booster program from around the world. And perhaps the most interesting to-be-confirmed early evidence, to which I'll ask Paul to speak, is that much of the early evidence is of a mild set of outcomes and symptoms, but there is more evidence to come. The world is looking at this. We're cooperating with our international partners. We're well prepared, and we are in, I think, the best scientific hands in the world. And on that, I'll turn to Professor Kelly.